The most important metabolic troubles of sheep and goats. Nutritional disorders. So pregnancy, toxemia, causes ketosis and twin lamb disease. So it happens in ewes and does. What is it? The glucose decreases and it can cause brain damage, dehydration, renal failure, and death. Happens in late gestation during the last 4 to 6 weeks. The causes are inadequate energy intake, rapid fetal development, so 70% happens in the last part of pregnancy, and increases energy requirement. And the body fat is broken down to meet nutrient requirements, and ketone bodies are produced. The dams are most at risk in late pregnancy or carrying multiple fetuses. Abnormal body condition score, so too fat or too thin, and decreased feed intake, and the rumen volume decreases. The feed, so low nutrients, or if the feed intake decreases due to foot rot and abscesses. The signs are separate from the flock. Eating and rumen motility decreases, and nervous signs such as dullness and blindness. You treat with glucose, xanthol, and good quality hay and oats. Perform a cesarean section needed or induce lambing. Prevent with a good body conditioning score, and scan mothers early to identify twins and triplets. Hypocalcemia. So this is milk fever or bark-protuned paresis. Happens in ewes and does. So when the calcium decreases, the muscle contractility decreases. And the cause is decreased calcium intake through grazing and cereal, and high oxaloacetate intake, and the inability of calcium metabolism and absorption. Dams are most at risk in late gestation or early lactation the first 10 weeks, and in older dams and multiple fetuses. The signs are rapid onset, weakness, stiffness, uncoordinated gait, rumen motility, vaginal prolapse and muscle tremor in does, and death within 24 hours. You treat with a calcium injection IV, rapid recovery, diagnosed between hypocalcemia and pregnant toxemia. They don't recover quick with pregnant toxemia, and repeated treatment. To prevent, make sure the provision of adequate calcium during gestation. The calcium phosphorus ratio should be 2 to 1. So enterotoxemia. It's more frequent in sheep than goats. Overeating disease or pulpy kidney disease happens in any age, but it can happen in lambs. From a high carb diet, a lush green pasture. The etiology is high carb diet. Clostridium perfringens type D. Vascular permeability increases in the brain. Clinical signs are sudden death and pushing the head against a fixed object. Lesions, edema, malacia in the cerebellum, and autolysis in the kidney. The diagnosis is sudden death and innate toxin in the small intestines. The control is immunization, increased over 20% highly fermentable carbs within caution. And next disease is polyoencephalomalacia. It's a thiamine deficiency. So fattening lambs and goats are affected from a hard carb diet. The rumen pH decreases, and thymase producing bacteria increases, and from weeds and ferns they have thymidase, and they decrease thiamine. Clinical signs are decreased appetite, dullness, stargazing, spasm, death, recumbency, and the control is thiamine therapy, so increase the forage intake. White muscle disease. So this is from a selenium and vitamin E deficiency. It happens in sheep more than goats, and lambs and kids. Acute degeneration of cardiac and skeletal muscle. Clinical signs are stiffness, arched back, cardiac arrhythmia, respiratory disorders, and necropsy is white striations, and you treat with supplementing selenium and vitamin E. And erythrolysis, so it's from round sediments of proteins and minerals, happens in castrated and intact rams and bucks. The causes are excess potassium and calcium excreted, cereal grains and feds, and the obstruction is more common in rams and bucks because the appendage at the end of the urethra is narrowed, and underdevelopment in castrated rams and bucks. The signs are urinary blockage, painful urination, kicking around the genitals, lethargy, appetite decrease, and bladder rupture and death. Prevent by giving a calcium phosphorus ratio of less than 2 to 1. High hay and alfalfa used to treat urinary stones, and forages, weeds, having high silica decrease the content. So cobalt deficiency, constituent in vitamin B12 from weaned lambs in late summer, causes it's low in the soil low in cobalt. Clinical signs are immune suppression, anemia, and poor lethargy, and the management is giving cobalt lick salts.